Well, we shall start our hearing then. Again, we're considering the nomination of Mark Cruz to serve as the Director of Indian Health Service at the Department of Health and Human Services. President Trump nominated Mr. Cruz for this position on June 1st of 2026. Mr. Cruz, it's great to be able to welcome you to the committee, and I offer my congratulations on your nomination and my thanks for your willingness to step into this position. I appreciated the opportunity that we had yesterday for the discussion. You made a couple points yesterday that I felt were really compelling and are worth repeating here today, because I think that they demonstrate a very clear understanding of the role that you have been nominated for and the responsibilities. First, you said tribal consultation is a process, not an event. Think about that, how important it is, because so much of the time around here, tribal consultation is just kind of a check-the-box exercise. We meet for one meeting, and boom, we move on to something else. But you say tribal consultation is a process, and I could not agree more. Meaningful consultation requires ongoing engagement, trust, and accountability, and you're certainly going to be doing a lot of it as director if you are confirmed. You also noted that HHS is a federal department that touches the lives of Native people from birth to death. And this observation reflects both the scope of the department's responsibilities, but also the importance of just getting it right. You've got a full spectrum here. The director of IHS is the most senior Senate-confirmed official at HHS, charged with carrying out the federal trust responsibility and advancing the agency's mission of improving health outcomes and addressing long-standing disparities that face American Indians and Alaska Natives. And if confirmed, you will oversee health care services delivered through federally operated facilities, support tribal health programs operating under self-determination and self-governance authorities, and work with urban Indian organizations that provide critical services to Native people living in urban communities. You'll also be called upon to understand the unique challenges facing Native communities and to help develop practical solutions that improve access to care and health outcomes. And while you do not come from the career ranks of IHS, your experience gives you a strong foundation for this position. Your lived experience in Native communities, your service as first tribal senior advisor to Secretary Kennedy, and your previous work at the Department of Interior as Deputy Assistant Secretary for Indian Affairs have provided you with valuable perspective and experience. I also recognize your role in advancing the President's FY27 budget proposal for IHS, which includes an 11% increase in funding, continued advanced appropriations, and full funding for contract support costs and 105L lease obligations. You noted that the budget submission reflected partnership and consultation with tribes. I think this is really important for every agency that fulfills the federal trust responsibility. The committee has received more than 40 letters from tribes and tribal organizations that support your nomination, and those letters will be included in the hearing record. I've also heard myself from tribal leaders in Alaska who have spoken highly of your understanding of the unique legal and policy framework that governs Native health care and tribal programs. So, Mr. Cruz, I don't usually say it before we've actually gone through the hearing process, but I am looking forward to supporting your nomination and working with the Vice Chairman and our colleagues to move your nomination through the committee. IHS needs a confirmed director. You know there's a lot of work ahead of you. We continue to face significant challenges, including workforce shortages, behavioral health needs, aging health facilities, and ensuring that tribal self-determination remains at the center of federal Indian health policy. And these are issues that not only require sustained attention, but real partnership throughout it all. So I'm looking forward to hearing more from you this morning about your vision for IHS and your priorities. I anticipate that members will have additional questions for the record, and I will look forward to your responses to those as well. So again, thank you for being here. Congratulations on the nomination, and I will now turn to the Vice Chair, Senator Schatz, for his comments.
Thank you, Chair Murkowski, and thank you to the nominee and his family for being here. If confirmed as the director of IHS, Mr. Cruz will manage a multi-billion-dollar budget and approximately 15,000 federal employees. He will also be the most senior Senate-confirmed executive charged with carrying out the agency's mission and will be expected by statute and tradition to fulfill the federal government's trust and treaty obligations to provide health services to American Indians and Alaska Natives and improve their health outcomes. At a time when IHS faces persistent workforce shortages, aging infrastructure, and ongoing concerns about service delivery, this committee has a responsibility to carefully examine whether any nominee is prepared to meet the demands of this position from day one. This responsibility takes on added significance as tribal nations navigate proposed changes across the federal government, including actions that may affect the delivery of trust and treaty obligations that are often happening without meaningful tribal consultation. So in today's hearing, I look forward to hearing how Mr. Cruz, if confirmed, plans to strengthen the quality and access to health care services for American Indians and Alaska Natives, improves operations, and addresses challenges facing IHS, especially the workforce shortage. These duties are critical no matter which party is in the White House, and so today's hearing is an opportunity for Mr. Cruz to demonstrate his commitment to serving Native communities and his readiness to provide leadership, expertise, and the advocacy necessary to uphold the federal trust responsibility. I thank the chair for convening this hearing, and I look forward to hearing from Mr. Cruz.
Thank you, Vice Chair.